What an important contribution to our conversation. He's a professor at the Johns Hopkins School of Medicine and Bloomberg School of Public Health, and the author of the new book, Blind Spots, When Medicine Gets It Wrong and What It Means for Our Health. Dr. Marty Makary, great to have you back with us, sir. Thank you very much.
Good to be with you, Vince. Thanks for having me.
It does seem important. And I'll admit, let me confess that this is an issue that I have not thought about that way, and I'm ashamed of it. I saw Tucker Carlson's conversation with Casey and Callie Means recently. And I realized, like, all of our public debates about how much more should we spend on medicine, how much should we cut in Medicaid or Medicare, all of these points would be moot if Americans were healthier, correct?
Yeah, we've developed this giant blind spot in modern medicine. We've done a terrible thing to doctors. We've told doctors, put your head down, focus on billing and coding and seeing patients in short visits, and we're going to measure you, doctors, by your throughput. And so what we have is this whack-a-mole system where we just treat the late stages of diseases, and no one is talking about the big picture. No one is looking at the root causes. And the root causes are right in front of our eyes. We have a poisoned food supply, and these are things we can address. We've got highly engineered food additives, chemicals, and the body is reacting. The gut reacts with an inflammatory reaction. It's a constant inflammation, and it makes people feel sick, and it can make people feel sad too. And so the solution is not more antidepressants and more metformin and more meds. The solution is to address the root causes.
Yeah, and the attitude in America has become that there's always a medicine to solve your problem. COVID's a really perfect expression of this, and few people know this quite as well as you do, Dr. Makary. But I remember when we learned about COVID, and everything we know now, if the government was going to tell us anything, it should have been go out, take a walk, eat healthy, lose some weight, and that's going to do wonders for you. But that's not what they told us, was
it? They could never once mention obesity. The number one modifiable risk factor for COVID death was obesity, which, by the way, is an inflammatory condition, and it's highly addressable. Not a wink, not a word from anyone. Instead, all we heard about was more vaccine doses and take Paxlovid. And Paxlovid, by the way, a study just came out showing zero benefit in low-risk individuals. Zero, none. This was one of the biggest public health campaigns of the last 2 years from the White House, from Big Pharma was pushing it, FDA. I mean, quite frankly, I couldn't even tell the difference sometimes between what FDA and Pharma was saying. But this was one of the biggest things. And no one would ever talk about our metabolic health, what we eat, our insulin levels, what drives obesity. I really don't think that American children are more disobedient than children in Japan, where obesity is rare. It's pretty clear what's going on in the United States. We have two versions of Fruit Loops made by an American company, Kellogg. One for Canada, where the food chemicals are banned and the colors are not as bright, and one for the United States children. Don't American children deserve the healthier version of Fruit Loops? I mean, these are basic things we can address.
So what role does the government play in this specifically? How does the FDA get involved in this in such a way that Americans are being made more sick?
Well, the main thing we need to do is educate the public. And that's why I wrote the book Blind Spots. I want people to know the truth about so many health topics. The government has been spreading misinformation on the food pyramid. I mean, the food pyramid is maybe the greatest source of misinformation in the modern era. And the issuance of that food pyramid guidance parallels the modern increase in obesity rates. So the main thing we need to do is educate the public. But we also have to take a look at what we're subsidizing. We're subsidizing a lot of the seed oils by driving down the price of corn and soybeans. And we're also allowing chemicals that are banned in other countries to go unchecked. You don't have to provide any studies that chemicals are safe when you add them to the food. In the United States, it's a unique American sort of situation. So there are things the government can do without using its heavy hand of regulation.
You know, on the recommendations, famously, the food pyramid said that you should eat like a ton of bread every day, and most people don't think that's a good idea anymore. The other thing that the FDA recommends, literally to this day, which stunned me, is that up to 10% of your diet can be added sugar. That's a healthy thing. That your sugar intake should be 10% of your daily calories, and that's healthy. That's unbelievable.
Yeah,
Added sugar?
That's what the American Heart Association says. And do you know where they get that from? That kids should have up to 10 grams of sugar a day? They made it up. I mean, they're literally just making stuff up. And there's no basis for this. I mean, how much added sugar should a kid have? Zero. They should have zero. The sugar they should be eating is natural sugar. It's in fruits and vegetables, and it's bound to fiber, and it's not going to kill them. So maybe we need to talk about school lunch programs instead of putting every kid on Ozempic, as they're pushing for now. And maybe we need to treat more diabetes with cooking classes, not just throwing insulin at everybody. We've got to deal with these root causes, and we can do it.
So, Dr. Makary, Dr. Casey Means, I mentioned earlier in the program, Stanford-educated doctor who's now committed her life to the very issues that you're talking about. What she brought up something, which I didn't realize, which is that medical professionals, like doctors, very often receive almost no meaningful training on nutrition when they're in medical school, or at least spend very little time on the subject. Is that true?
That's true, and the key is meaningful, because the 2 hours of nutrition education that a medical student told me they recently got at one of the medical schools in the United States was basically misinformation. It was the old broken food industry stuff. 3 glasses of cow's milk a day, eat bread, never mind the fact that we've stripped it of fiber and it's just sugar. Ignored all these other issues like seed oils and pesticides. So basically, the educational system is broke. And so a lot of us now, a group of doctors, Casey Means is one of them, Peter Attia, myself, we're going directly to the public. Mark Hyman has been doing this. Through podcasts, through books, we're trying to educate people. And guess what? A lot of doctors are getting their nutrition and health education from these sources. I sat next to Casey Means at that hearing that was on at the Senate. Yeah. She had a powerful testimony, and I posted it on Twitter if anybody wants to go see it.
Well, and you mentioned, you've talked about some of the afflictions, the obesity rates sky high, and all of the follow-on illnesses that follow high levels of obesity clearly are the thing that, in terms of the medical system, that's what a lot of that is costing us so much money, the maintenance of that affliction. The other thing that stands out to me is birth rates have been going down pretty dramatically all around the world, but especially in the United States. Fertility problems have run rampant among women. Sperm counts have dropped precipitously among men. How deeply intertwined do you think those issues are to the quality of our food and what's going on with medicine?
Directly. And let me tell you why, Vince. Because pesticides, they kill pests. What do you think they're doing to our gut lining of the microbiome, the millions of bacteria normally in the gut that help with digestion and absorption and train the immune system and produce serotonin involved in mood? And so pesticides are known to have hormone-like binding properties. They bind to estrogen receptors. And so, hey, is it a big mystery that the average age of puberty goes down by a week and a half every year? Is this the riddle of the Sphinx? No, it's right in front of our eyes. And I think sometimes we can't use common sense to say, hey, all these chemicals going down the GI tract, they're all new in the modern era where we've seen a rise in GI cancers, like colon cancer going up in young, healthy people under age 50.
Yes.
So we need some common sense. People always ask me, is AI going to fix healthcare? And I tell them, we just need I.
We just need I like that. Hey, one of the challenges here as we talk about this issue is that unfortunately it can get rather expensive to try and clean up your own diet. It's very hard. I was, I've been talking to my wife about this, and just even like shopping for like organic chicken, trying to get the right stuff without all the hormones in it and all the antibiotics. It's expensive. I think she told me last week, she was like, it's like $5 a breast, and that's uncooked. We've got to prepare it. And you start to realize, like, how do we do this? It's really hard for people to afford to break out of this system. At the bigger level, how are we going to have to approach this, Dr. Makary?
Well, we're paying one way or the other. If we're not paying for healthier foods, we're paying for metformin and ICU stays and chronic diseases that are miserable. And people are suffering now. It's like, when kids are smoking cigarettes, they don't see the downsides because they don't think about their long-term health. They're not concerned about dying early. When you're a teenager, heck, risk appeals to you. You just don't think about it. So we're trying to educate people. If you want to live longer and feel better, there's a lot of things you can do. And one of them is taking that extra step. Organic really matters, especially when you're eating fruits or vegetables where you're eating the surface. So it may be less important for, say, watermelon when you're not eating the surface, but more important if you're eating strawberries, which the average strawberry is sprayed a dozen times with 7 different pesticides. So it's no longer the attractive fruit that you might think it is if you really understand the facts about how it's being produced.
That's a smart tip. Yeah, if you're eating the surface, that's where it matters the most. All right, Dr. Marty Makary, it's been too long since we've talked. I'm so glad you're back, and I'll chat with you again soon with any luck. Thank you, sir.
Good to be with you, Vince.
That's Dr. Marty Makary, his book, Blind Spots, When Medicine Gets It Wrong and What It Means for Our Health.